Sirens go flying by the same way your loved one just left to go, and now your loved one's not answering your phone calls. Your mind goes straight to, there was probably an accident and it was probably them. You have sweaty palms, a racing heart, and you can't think straight. You are feeling a form of anxiety. I've struggled with anxiety since I was a young child, but have more recently struggled with severe anxiety in the past year. As a way to cope with my anxiety, I've turned to learning more about it. Anxiety is a leading mental illness in the United States, which means at some point in your life, you or a loved one may struggle with it. You may also struggle with temporary anxious feelings, such as the feelings you have before a public speech. Today, I will inform you on two types of anxiety, panic disorder and general anxiety disorder, along with the symptoms and possible treatment options. General anxiety disorder is the most common form of anxiety, and general anxiety disorder is where someone has excessive worry and disproportionate thoughts about general aspects of life, such as relationships, school, money, health, and several other things. According to ADAA.org, 6.8 million adults struggle with general anxiety disorder, but only 43.2% of those adults are receiving treatment. Women are 2 times as likely to struggle with general anxiety disorder, and it is most common to begin in childhood, but can begin as an adult, according to WebMD.com. There are no blood tests to diagnose general anxiety disorder, so if you think you are struggling, you should see your doctor or your psychiatrist, and they can help diagnose it. One tool that is used to help diagnose general anxiety disorder is called the DSM-10. This has different categories that rates where you sit for if you're struggling with general anxiety disorder. The first question on there is, do you struggle with worry more days than not, lasting 6 months or longer? The next category on there is symptoms, which you must have 4 of the symptoms or more present. Some symptoms listed on there are palpitations, sweating, chest pain, nausea, and fear of death. Your disorder can also not meet the criteria of any other disorder listed on the DSM-10, such as OCD, hypochondriac, and panic disorder. Your symptoms also cannot be related to substance abuse or any other health issue. These are just a couple categories to help determine if you're struggling with general anxiety disorder. According to the National Library of Medicine, in 1980, anxiety was called anxiety neurosis, but was split into a second category called panic disorder. Panic disorder is spontaneous panic attacks and then the fear of having another one or when another one will occur. When interviewing a coworker named Abby who struggles with panic disorder, she said, "I all of a sudden feel like I can't breathe and have something heavy on my chest." Panic disorder usually begins after 20 and is 2 times as likely to affect women as it is men. The same as general anxiety disorder, the DSM-10 diagnostic tool is used to diagnose panic disorder. Questions for panic disorder on the DSM-10 are, as a result of your panic attacks, have you experienced a fear of places or situations where getting help or escaping may be difficult? Another question listed is, are you troubled by repeated or unexplained attacks during which you feel intense fear for no apparent reason? These questions are from ADAA.org under the diagnostic tool. Overall, there are several types of anxiety, but just between general anxiety disorder and panic disorder, several people are affected on a daily basis. For general anxiety disorder and panic disorder, there are a wide range of symptoms that come along with them. For general anxiety disorder, some of the less severe symptoms that you may feel are restlessness, irritability, tiredness, sweaty, trouble concentrating, trouble falling asleep, and many more. Some of the more serious side effects that you may feel with general anxiety disorder are panic attacks, trembling, weakness, hyperventilating, increased heartbeat, chest pains, and several more. Panic disorder usually comes with more severe side effects and symptoms, but some of the less severe symptoms are numbness in your hands and fingers and a sense of loss of control. The severe symptoms that come with panic disorder are breathing difficulties, dizziness, sense of doom, and chest pains. Although the types of anxiety and the symptoms are important, the most important is the treatment options available to you if you need them. The first treatment option available are medications, which can be prescribed to you by your doctor or your psychiatrist. There are different categories of medications, and one category is called serotonin selective reuptake inhibitors. These give your brain more serotonin, which improves your mood. Some examples are Zoloft, Lexapro, and Celexa. Next are mild tranquilizers. These help induce sedation by reducing irritability and or excitement. The mild tranquilizers are usually used when you're in a panic attack to help bring you out or lessen the symptoms that you are having. Some examples of mild tranquilizers for anxiety are Bucifar or Xanax. There's also therapy options such as CBT therapy. These help to change your thought process towards the triggers that trigger your anxiety. Next are just normal therapy sessions with your therapist or counselor where you can just talk about what you're afraid of, your worries. They can help you with coping skills so that when you start to feel less severe symptoms, you can try and bring yourself out before your symptoms become severe. And then although natural options are not widely studied, there are natural options suggested that can help lessen your anxiety. One option is yoga. This helps calm your body and muscles and gives your body a sense of ease and relaxation. Another option is omega-3 fatty acids, which provide your brain with EPAs and DHAs, which are needed for optimal brain function. Some ways to get omega-3 fatty acids are in fish or tuna oil supplements, or just in foods such as soybeans, chia seeds, and flax seeds. There are several treatment options to help you cope with your anxiety. All in all, anxiety is a very serious disorder and it affects several people. It can affect you or somebody you love in their lifetime or yours, and it is important to know the different types, the symptoms, and options for those struggling for treatment. Remember, worrying does not take away tomorrow's trouble. It only takes away today's happiness.